All right, diving in today, and we've got something pretty fascinating on the table. We're going to be looking at prostate cancer treatment, specifically a new AI tool called Unfold AI. I know you've looked into how it's being used with focal cryoablation.
Yeah, this is really interesting stuff. I think the key here, the big takeaway for our listeners is Unfold AI's potential for predicting success with focal cryoablation. We're talking about localized prostate cancer here, and the sources you sent over really emphasize this AI's ability to make sense of MRI scans and biopsy data. Gives us a clearer picture than we've had before. Helps doctors figure out if this less invasive treatment is the right choice for a patient.
Okay, so you keep saying clearer picture, precise measurement. For someone who doesn't spend all day looking at scans, what's the difference here? Is it like just a slightly better ruler?
No, it's much more than that. See, traditional methods, they kind of rely on looking at individual slices of an MRI, trying to get a sense of the tumor's size and shape from those.
Okay, like trying to figure out the size of an orange just by looking at a few thin slices.
It's subjective,
Yeah.
right? And that's where Unfold AI comes in. It's amazing. It actually creates a full 3D map of the tumor. That's the game changer.
Yeah.
One of the researchers even said something like, this is allowing us to measure tumor more precisely. And they're right. This kind of measurement just wasn't possible before. Huge implications for predicting the success of treatments like focal cryoablation.
So a full 3D map instead of just a few flat images. How does that actually translate to, better outcomes for patients actually going through this treatment?
So the research you shared, very interesting. They looked at over 200 prostate cancer patients, all different grades, and found a very clear correlation between tumor size and how well focal cryoablation worked.
Makes sense, right? Smaller tumor, easier to target, more likely to get it all.
Precisely. They found that men with smaller tumors, specifically under 1.5 cubic centimeters, did significantly better at the 6-month follow-up.
That's great. So with this AI and the 3D mapping, how much of an improvement are we talking about in terms of, predicting who will benefit from this type of treatment?
The study suggests, and this is really remarkable, that using AI to measure tumor volume could reduce treatment failures by over 70%. Think about that, a 70% reduction. That's a huge leap forward.
That's a staggering number. So by identifying those men with smaller tumors who are best suited for this focal cryoablation, you're also avoiding the downsides of treatments that might not be effective.
Absolutely. Less invasive, fewer side effects, faster recovery. The whole point is to avoid unnecessary burdens on the patient. And this study, the fact that it included men with all those different grades of prostate cancer, really drives home the point that tumor volume is a key factor.
And this AI, this isn't just some, pie in the sky concept, right? It's actually already been approved.
Right. Yep. Got FDA approval in 2022, which means it's moving out of the lab into the real world. It's on its way to community oncology settings, which is huge for accessibility. It means this kind of advanced analysis is going to become a part of treatment planning for more and more people. And of course, they're planning bigger multi-center trials to really solidify its effectiveness across a wider range of patients.
This is really exciting stuff. It's one thing to talk about research, but knowing it's actually being put into practice, that's where it gets really interesting.
For sure.
So let's talk about the why. Why does all of this matter for the future of healthcare?
Look, Unfilled AI is more than just a new tool. It's a powerful example of personalized medicine in action. We're talking about prostate cancer, but the implications are much broader. Think about it. This AI gives us a more objective, more accurate assessment of the tumor, right? Which leads to better decisions about treatment, in this case, focal cryoablation.
And that, like we said, could dramatically increase the chances of successful treatment.
Exactly. But there's more. By better selecting those who are good candidates for focal cryoablation, you're also potentially reducing the need for those more aggressive whole gland treatments, the ones with all the serious side effects.
Huge quality of life implications there.
Absolutely. One of the researchers put it really well. Using AI to understand tumor volume and shape, it could help choose better candidates for focal cryotherapy. It's all about choosing the right treatment for the right patient at the right time. That's the future we're moving towards. And tools like Unfold AI, they're a big part of making that happen.
So to wrap this up, what we're seeing here is a new level of precision in prostate cancer treatment. Unfold AI uses existing scans, creates a detailed 3D model, and allows doctors to much more accurately determine if a patient is a good candidate for this less invasive treatment.
That's the gist of it, yeah. And like we've been saying, this precision translates into better treatment decisions, better chances of success, and potentially avoiding those more aggressive treatments down the line. Huge win for patients.
It's fascinating to see how AI is impacting healthcare, and this is just one example. It makes you wonder, as these tools keep getting more sophisticated, how will it change our entire approach to treatment? What will it mean to successfully treat a disease? And how will it redefine personalized care? Lots to think about. Thanks for being here today. It's been a really insightful conversation.
My pleasure.
And to our listeners, thanks for joining us for another deep dive.